COVID revealed some weaknesses in the healthcare system and long-term care system that we've seen over the last couple of years. Staff shortages have now become a real problem with people leaving, some describe in droves, and there is that difficulty bringing new people in, perhaps because they feel they may be burnt out as soon as they get in. What will your party do to ensure hospitals and long-term care facilities can meet those challenges, and specifically here because of the aging population that we have in this riding?
The healthcare system is one that I've taken quite an interest in, actually. Digging around into the causes, the issues that we're having with our healthcare system now, what I found was our system has been designed to work at capacity all the time, and that was pre-COVID. So that's why every year when there'd be a flu outbreak, the hospitals would always get overwhelmed. When COVID came along, it was like flu times 100 probably, and so we saw something really overwhelming. In hindsight, armchair quarterback, I believe that the government, at the time that they knew when they were starting to consider 2 weeks to flatten the curve, at that point we should have been looking at some major increases in capacity. We spent a lot of money paying people to stay home for quite a while. My belief, again, it is in hindsight, so I have that, but if we had taken at least part of that money and worked on increasing the capacity, bring in more nurses and more doctors and things like that at the time, we would have probably spent just as much money, but at the end of it, we would have had something better. The other thing, obviously, firing a whole bunch of nurses and doctors partway through the pandemic because they wouldn't comply with the vaccine requirements wasn't the smartest move in my estimation. You already have a shortage of people. Now you're going to kick a bunch to the curb because they won't fall in line. So hiring those people back, I think, is a priority, and also hiring the new people that we need. Now, I've heard other candidates talk about, we're going to hire 10,000 nurses, or we're going to hire 20,000 nurses, or whatever. That's all well and good. We need to make this stay affordable. I know the conservative budget calls for another, I believe it's $20 billion in budget for healthcare. We can't continue to just spend more and more. Our view on the healthcare system is that we have to look at the structure of it, and we may need to make some changes to how we're actually delivering healthcare in Ontario and probably in Canada. One of the disadvantages that the Ontario health system has is it's a very bloated system in terms of administration. And if you look at it compared to other countries, and I've done a little research on this, if you look at Canada compared to Germany, Germany has roughly twice as many people as Canada. However, they have socialized medicine, and their system is considered the best in the world. On the other hand, Canada actually pays more per capita to deliver our socialized medicine program, and we are near the bottom in the rankings of all of the metrics, number of physicians, number of specialists, wait times, availability of diagnostic equipment. We're consistently near the bottom of the socialized medicine systems in the Western world. Canada has per capita roughly 10 times as many administrators per capita. That costs a lot of money, and we have a multi-tiered system, lots of levels, lots of bureaucrats in there. Some of them are making pretty big money, and I don't want to question what people's salaries are, but for the money, if we trim that side of it, that should allow us money to hire more doctors, nurses, caregivers, et cetera. So that's definitely something that we need to look at. The other thing, if you look at all of the other socialized medicine systems across the Western world, Canada is the only one that is purely social, purely government-provided healthcare. Every other system has some form of hybrid system where there is some for-profit, some private healthcare in there. We actually still pretty much ban that here. And again, if you look at the stats, Canada having this purely social system ranks at the bottom of the deliverables for our healthcare system. So we've always been pretty proud of our government so-called free healthcare system, the government-provided healthcare. But I think it's time that we need to look at some options to inject some more capital in there that we don't have to pay for in order to get this back up and running and to deliver the level of healthcare service that we need to.
I'm going to bring up one example where some of that action's already taken place, and that's the First Nations Technical Institute over in Tyendinaga, where they just recently announced some direct-to-work programs for new students to get them to be in long-term care specifically. Is that relationship with post-secondary important, perhaps the best option, or is there a better one where you, as you say, bring some of those workers back with the least cost. And you do mention a reduction of bureaucracy. Is there any one best option to remedy this healthcare situation?
I think it's going to be a combination of things. Obviously, if we can convince care providers that used to be in the system and come back, you save a lot there, and you get a better, more experienced person to begin with. You don't have to pay to train them, and there isn't that lag time for them to get up to speed. So I don't think there's enough of the experienced ones to cover, so we are going to have to train some new people in, and we should definitely do that. In terms of the restructure, I don't have the specifics. I know that we have multiple levels of bureaucracy, starting at the federal level, then the provincial level, then the local area, and the individual hospitals. And just based on the fact that we have such a large comparative number of admin positions, there will be savings there. Something that I've heard anecdotally is that we actually have one administrator for every care provider in the province. And these are not cheap salary positions, these admins. So I think Japan has somewhere around 1 to 12. So for every administrator, there's 12 caregivers, and we're at 1 to 1. So there is room for improvement, certainly.
Question 4 is, it's got some parts to it, so bear with me here. COVID revealed some significant weaknesses in our healthcare system and our long-term care system, both of which seem to be still challenged by staff shortages and the difficulty of attracting new people. So in your government, what will you do to ensure hospitals and long-term care facilities, as well as home care and personal support and all that goes with it, can continue to meet the challenges we face, particularly in this region with our aging population?
Yeah, so we do have one of the older regions in the province, more seasoned, as I like to say, and those individuals are going to be requiring more health care over the next number of years. And sadly, this is an area that's been neglected for far too long. It was a big piece of our 2018 election plank. We were going to create 30,000 new long-term care beds. We were going to renovate thousands more. And I'm happy to say that we do have 30,000 new beds in the development pipeline and over 27,000 refurbished beds in the pipeline. But it can't just be about the bricks and mortar and the new beds. It's got to be about training those healthcare workers that aren't just going to work in long-term care or in our hospitals. They're also going to be working in our home care, which seems to be very disjointed. And that's where the Ontario health teams come in. We did away with the local health integration networks. The LHINs were just another layer of bureaucracy. These Ontario health teams are going to be working to ensure that we're providing the services in communities where it's necessary. And in our area, not everybody wants to go to a long-term care facility. Many people are going to choose to stay at home, but we have to ensure that we have the resources there with our partners in the home care sector to provide those services in a coherent fashion in people's homes. So we need the PSWs, we need the nurses, we need the RPNs, we need the doctors. They're all going to be so essential to getting people the care that they need wherever they choose to get it.
Yeah, and working conditions in hospitals, as a government trying to be on the ground, it's, nurses and people in hospitals and these long-term care facilities are getting really burnt out. So I'm just looking to see what the plan is for improving working conditions or wages or anything that may prevent or mitigate more nurses going off on sick leave or personal leave, and still address those staffing shortages as well.
Well, help is on the way, is all I can say. 300 additional nursing students every year just from Loyalist College, and hopefully that will help alleviate some of the pressure on our local nurses, either at the hospital or in long-term care or home care now. But all those PSW jobs as well that are coming. What I would say is that for far too long, there was too much of a focus on wages and not enough in preparing the workforce of the future. But we've changed that, and help is on the way, literally in the form of new nurses and new PSWs. So that's what's really going to make a difference and take the pressure off our hospitals. Certainly the fact that we've been able to stabilize the funding formula at small and medium-sized hospitals and multi-site hospital corporations like Quinte Healthcare is going to make an enormous difference. I stood in the legislature year after year under the previous government when QHC had to fire nurses at the end of the year because they just couldn't fit it within their budget. Well, we are now treating those hospital corporations fairly so that they have the funding where, first of all, they can continue to retain the nursing jobs that they have, but add more. And we no longer have to worry about Trenton Memorial Hospital closing its doors or the same thing potentially happening in Prince Edward County. We're building a brand new Prince Edward County Memorial Hospital, and Trenton Memorial Hospital is on the most stable financial footing that it's been on since Quinte Healthcare was formed.
COVID revealed some significant weaknesses in our healthcare system and our long-term care system, both of which seem to be still challenged by staff shortages and the difficulty in attracting new people. What will your government do to ensure hospitals and long-term care facilities can continue to meet the challenges we face, particularly in this region with our aging population?
Oh, man, our healthcare. Yeah, decades of critical services were cut before the pandemic. And we saw the results of that. As we talked about, we're facing a doctor shortage. Families like mine now are without a doctor. And my husband, who has chronic pain, is very concerned about that because now it means he's going to have to go to our emergency to get prescriptions filled when he could have easily just gone to his family doctor. So we really want to, the Ontario NDP, we are going to focus on recruiting, retaining, and bringing back retired nurses to the industry. And by doing that, we're going to provide this mentorship program. So you can have the retired nurses come back and share the knowledge. Like, we've lost so much knowledge of the healthcare because people just said, I'm done. I'm walking away. I'm exhausted. I have zero respect from the government. I have my pay cut. And it's not okay. So we're going to bring them back to be able to retrain nurses, to provide supports. We're going to repeal Bill 124, which we know capped the nurses' wage. One other thing we're going to be doing is, we know in our community, nurse practitioners are so golden and so spectacular. And I know in the county, everyone knows Nurse Pat. Everyone knows Nurse Pat, right? You're laughing. You know Nurse Pat, right? She used to run those new mom programs. And I go to the doctors and Nurse Pat would be there. And so what we're going to do is we're going to provide more funding for nurse practitioners to lead clinics because we know we need that. I know that's something Mayor Mitch is talking about wanting to do. Just north of Belleville, is have this practitioner-led clinic. And we believe so deeply in doing that. As mentioned, we're going to bring prescription drugs, dental care, eye care, mental health care into the OHIP system. And I think, Nicole, you probably know this, long-term care facilities in Belleville, there's over 1,500 people waiting for 482 beds. And there is an average of a 3-year waiting list. Now, I know we're hearing from the Conservatives, we're going to build these beds. Well, that's lovely. But what I'm hearing, and some concerns from nurses, is if you're not bringing in new workers, that means I'm going to have double or triple the amount of people I'm going to have to care for during my shift. And it's not working. It is not working. You can build all the buildings if you want, but if there's nobody to work in them, then you are just throwing that money away. We need to be investing in the people. So one thing we are going to do is we're going to move to making the entire system public and not for profit. We've heard of many not for-profit long-term care facilities who made so much money, millions, while staff, PSWs and nurses were leaving the industry because they were working so hard and getting very little respect, not getting paid enough money. So we're going to hire thousands of PSWs. We're going to, raise those wages by $5 per hour. And we're going to implement a standard 4-hour care per resident immediately, right? Again, I was talking to a nurse. She said, before the pandemic, I had 6 patients. Now I have 15. Right? And the stress that puts on our healthcare workers that went into this industry because they care for people And they know they're not providing the quality of care that they want to because there's not enough of them. One other thing I do want to mention, which I think is really great, is the Ontario NDP believes that seniors should stay in their homes as long as they want to. So we're going to, again, hire more PSWs to go into the homes to work with the seniors. We're also going to cover the travel costs for the PSWs because we know in our community, because it's so rural, you might be Long Point, over to Consacon, up to Madoc, right? We want to make sure that that the PSWs are being compensated for their cars. And the other one thing I do want to make note of, we're going to introduce a caregiver benefit program. So for those who are providing support to their family members, they're going to get a $400 a month respite care to be able to help offset the cost of being able to provide that care for their family member.
You mentioned keeping seniors in their homes longer. There's many seniors that are living on fixed incomes and having just significant difficulty trying to make ends meet. What is your party plan to do to help seniors so that they can financially stay in their homes?
I spoke to a woman last week, and she answered her door. So we went into a building, we knocked on all the doors, finding out it was a low-income building, a lot of people on ODSP, a lot of seniors who were there, a lot of people actually moving to the community to be closer to their families. And one woman opened the door, and I started talking with her. I asked her, "Are you planning to vote?" And she said to me, "Well, I don't think I'm going to be alive in 3 weeks." And my heart just sunk because you can feel the sadness and the fear off this woman living in this apartment alone, thinking of how she's not going to be alive in 3 weeks. And it just, you can't hear those stories and not feel rage, knowing that the government sat on billions of dollars during the pandemic that should have gone to people, should have gone to supporting these long-term care facilities, should have gone towards our education, our seniors. So the other program I do want to mention is we know there's overcrowding and hallway medicine in our hospital. It was created by previous governments. And so we're going to be providing rehabilitation and therapy in the home or in the community. So we're gonna hire people and create programs for us or for those support people to go to the homes of these seniors, so they don't have to come out and take up space, well-deserved space. Don't misunderstand that, but bring it to them for a sense of ease. We're also going to ensure that, because a lot of seniors we're hearing, they are selling their home because they're not able to keep up paying their property taxes on top of the fixed income and the cost of food. And so what we're going to do is we're going to cover those costs. So if you are over the age of 55 and you want to stay in your home and you're not able to pay your property taxes, the government is creating a program that we will pay those taxes. And then when you choose to sell your home or your family chooses to sell your home, at that point, we will then settle up or work on that payment for the property taxes, because we don't want people to feel they have to leave their homes, leave their communities, leave their friends, leave their family, and go move into another home where they're going to be alone and scared. So, we care deeply for the seniors and want to ensure that they feel valued and loved and appreciated.
COVID revealed some significant weaknesses in our healthcare system and our long-term care system as well, both of which seem to be still challenged by staff shortages and the difficulty in attracting new people. What will your government do to ensure hospitals and long-term care facilities can continue to meet the challenges we face, particularly in this region, with our aging population?
Yes, fantastic question. We need to revolutionize elder care across Ontario. No government has been perfect when it comes to long-term care, but we have a plan in place to end privatized long-term care by 2028. And we believe that's going to empower our institutions and our people to get the care that they deserve. But moreover, we also want our seniors to age at home if they want to, which, talking to residents, speaking with my grandmother quite frequently as she navigated the journey of taking my great aunt through long-term care as her caregiver, my grandmother shared with me that she doesn't want to go through that process. And we know that there are countless other seniors that don't either. So we also have set aside funds to ensure that anyone who wants to age at home can age at home. And the way we'll do that is by providing 400,000 at-home opportunities, or by providing the funds to secure 400,000 seniors to age at home, whether that be through their home care, through respite workers, and everything in between.
Talking about staff, hospitals. Before the pandemic even began, we were still talking about the difficulty of getting a family doctor. We were talking about staff shortages at hospitals and healthcare and long-term care facilities. And the pandemic happened. 2.5 years later, almost, we have more stress, more people leaving the field, more people retiring early, people having to be forced out because they can't meet conditions while being understaffed. So there's never been this level of stress on those systems. How do we get more nurses, more doctors, and more resources, of personal resources available for the people who need it, and also for the people who are already on the front lines and need help?
Absolutely. Well, the first thing that we're going to do is repeal Bill 124, but we're also going to make sure that all of our workers in healthcare and education have the mental health supports they need, because we can't support our patients, our students, without supporting those that are supporting them. So we're going to make sure that everyone has the mental health care that they need. As I said, repealing Bill 124, no reason to cap wages at 1% for our healthcare heroes or our education workers. But we also really want to focus in on making sure that our recruitment targets rural areas as well when it comes to healthcare workers. So of the 100,000 new doctors, nurses, and support workers that we will look to hire during our tenure, we want to make sure that we're offering opportunities for folks who may go to school in Toronto or Ottawa to come back to the Bay of Quinte, or for folks to come to the Bay of Quinte. So if you are looking to practice in a rural riding or in a rural area, we will pay the medical or nursing tuition fees and costs for those students to incentivize them to come back to rural regions, because we do have a promise, and it's an ambitious one, to make sure that within 24 hours, anyone gets access to a nurse or a doctor, regardless of where you live in Ontario.
COVID obviously revealed some significant issues with our healthcare system and our long-term care system, both in terms of capital areas, in terms of attracting workers.
Okay.
What will a Green government do to ensure hospitals and long-term care facilities can continue to meet the challenges we face, particularly in this region with our aging population?
Mm-hmm. Okay, so the first thing I would say is that we need to take the for-profit modeling out of our hospitals. Right now, we have lots of patient citizens that aren't getting the services they require at our hospitals, or the time that they need to address their problems properly. Keeping hospitals public, not privatizing services. Putting more funding into long-term care. As we saw during the pandemic, our long-term care situation was bad. And particularly in the private care section, we had to call in the Army to fix some of these problems. If that doesn't emphasize to you that private care is not providing the services that we need, I don't know how else to describe it. Addition to that, part of our healthcare holes that we have are regarding our nurses. We've done a really terrible job taking care of our nurses, even though our nurses have done an outstanding job taking care of us, especially during this pandemic, and stepping up when we need them to. We did them dirty by capping their wages at 1%. That's technically 5%. Wage loss because of inflation. And we gave them no opportunity to bargain when it comes to the benefits that they need to support themselves. So taking a step back and allowing nurses to communicate what their needs and desires are, allowing them to have wages that reflect the work that they're putting in, it's going to create a better healthcare environment. So again, people will be getting the services and getting the care they need when they show up to the hospitals, because we're not going to have stressed out nurses that are working longer shifts than they need to and not getting support from their top down.
Okay. The question that always brings up, healthcare is already the largest part of the Ontario budget.
Yeah.
Every year, paying nurses more, doing all these things.
Uh-huh.
How do you pay for this side when you're already, when the province is already maxed out,
Yeah.
you might say, on the finance side, anyways.
Well, finance side, the Green Party of Ontario has a fully costed budget. So I'm not just talking here. We've already done the work to sit down and realize what kind of investments we need to make to ensure a better future. And I think that that's a major part of all parts of our platform, is understanding that making these types of investments now are going to secure a more sustainable future for us later. Particularly with healthcare, if you want to look at our budget, you'll see that we didn't go above and beyond. What we did is we took realistic amounts that nurses should be paying and put that into our budget first. Not focusing on bringing in extra doctors and utilizing nurse practitioners, nurse unit groups that we can already. And then the last thing I would say about it is that we're going to more efficiently pay for these services by developing a nurse council, one that communicates directly with our nurses front line to understand what their needs are and bring that to the table. We have these conversations, so we're not just throwing money around unnecessarily. We know directly who it's going to and why.